Brockville General has been dedicated to being your community hospital since 1885. We believe in providing a comprehensive range of services and world-class healthcare right here in Leeds and Grenville. Working with our hospital's leadership team, the volunteer board of directors is committed to achieving excellence together.
This year was an exceptionally busy one for the hospital. From modernizing our systems and clinical spaces to introducing new services, our teams have gone above and beyond to ensure we are meeting the growing needs of our community. As we reflect on an incredibly busy year, it's important to acknowledge and thank the people who have made it possible. Our leadership team is proud of the work that has been done and the adaptability demonstrated by our dedicated staff, physicians, learners, volunteers, and partners. We could not have been successful without each of you working so closely and so well together. Here are just a few of our many successes from the past year.
As the new Chief of Staff at Brockville General, I'm proud to share our family and family-centered approach to healthcare is baked into everything that we do. Our approach to your care not only meets yours and your family's needs, but also has an impact across our organization and our community. Through their unwavering commitment, and with the dedicated supports of leaders like Dr. Mike Fuoco and Dr. Karim Soumani this past year, we addressed critical challenges, including surges in patient volumes. These acts of teamwork exemplify our shared mission and vision. As we work to elevate the quality of care and strengthen our community ties, our professional medical and administrative staff took a significant step towards this year by embracing our new Equity, Diversity, and Inclusion framework. This initiative is designed to promote equity, foster inclusion, and create a supportive environment within the hospital and throughout the broader healthcare system. As we innovate at Brockville General, the vital connection of people cannot be underestimated. Effective human resource planning by our medical affairs team and our physicians has helped us recruit more than 30 talented physicians during this fiscal year. These professionals ensure our services continue to meet the evolving needs of our patients and their families. In addition, we have formed partnerships outside Brockville General that focus on attracting national and international talent to our community. By building our community's vibrant reputation and continuing to broaden our reach, we are confident in our ability to attract and retain exceptional talent.
At Brockville General, we recognize that teamwork is essential to our success. We value the contributions from our organization, patients, community, local and regional partners. The collaboration and relationships we foster with our internal and external teams enhance our daily environment and system functionality. In December, we launched Lumio, our new regional health information system. This project involved integrating systems that manage our patient monitoring, surgical services, dietary ordering, lab equipment, pharmacy, and financial operations. It was a significant undertaking, and we appreciate the incredible efforts of our staff, physicians, and leaders in learning the new system and navigating the changes while continuing to provide excellent patient care. We continue working to optimize the system to improve staff and provider workflows and find efficiencies in patient care. This project has strengthened our relationships with regional partners, and we continue to collaborate closely. We are committed to continuously improving our technology to support our organization and enhance patient care.
Our patients trust us with their personal health data, and we don't take that responsibility lightly, which is why Brockville General has dedicated teams working hard to protect your data and continually improve our cybersecurity to ensure we have the most up-to-date protection in place with continuous monitoring and reporting. We are continuously improving our technology to support our organization and improve patient care. Just this spring, we implemented a new cloud-based ticketing support system to allow our teams to report issues in an efficient way that will allow our information management, information technology team to respond even more effectively.
Over the last year, our cardiovascular department implemented a new dedicated advanced digital image viewing platform called a Picture Archiving and Communication System, also known as a CV-PACS. This upgrade will streamline how we access, store, and share cardiac imaging like echocardiograms, providing faster, more reliable image review and improved integration with our electronic health records. With powerful visualization tools as well as better overview of patients' past cardiovascular imaging history, our clinicians will benefit from more efficient workflows and enhanced diagnostic accuracy. For our patients, this means quicker results, better care coordination, and reduced exposure to unnecessary repeat imaging.
Our ultrasound department introduced the GE Logic E10 ultrasound system as part of our ongoing commitment to provide cutting-edge diagnostic care to the people of Leeds and Grenville. This state-of-the-art technology delivers exceptionally clear, detailed images using advanced ultrasound technology called C-Sound architecture and XD Clear probes. For our patients, this means more accurate and earlier detection of health conditions ranging from liver disease or breast lesions to obstetric and musculoskeletal concerns with fewer needs for additional imaging. The Logic E10 also brings a more comfortable and efficient experience for patients. Its AI-powered tools help clinicians perform faster exams and with greater precision, reducing scan times while maintaining high diagnostic confidence.
We're proud to be a key partner in the Lumio Regional Health Information System, a transformative step in how care is delivered across our region. To meet the evolving demands of this pivotal change, our clinical informatics and change management team has expanded, growing in expertise, collaboration, and impact. At the time of Go Live, we launched a Lumio Working Group, a collaborative team made up of clinical informatics, education leaders, and frontline clinical staff. Together, they tackled day-to-day workflow challenges and supported a smoother transition to the new system. But our commitment didn't stop there. We established a local change advisory board to make sure Brockville General has a seat and a strong voice at the regional table. It's all about making sure the right information flows to the right people at the right time. The goal? To make sure change is not only expected, but embraced. At Brockville General, we're not just adapting to change, we are helping lead it.
It's my great honor to provide leadership to the People and Support Services teams here at Brockville General. We're a team of 240 hardworking, skilled employees and more than 200 dedicated and gracious volunteers. Our goal as a team is to achieve excellence together, supporting the hospital and providing patients the best possible healthcare experience. We're very proud of the work we accomplished last fiscal year. Here are just a few examples of that work.
At Brockville General, the Human Resources Department is committed to improving the patient experience through robust recruitment and retention efforts. In October 2023, Brockville General partnered with the City of Brockville and the Employment and Education Center to launch the Imagine Brockville Life campaign. This campaign promotes Brockville not just as a great place to work, but a place to truly live, highlighting career opportunities in healthcare and the lifestyle this unique community has to offer. With strategic advertising placed across Ontario and Quebec, the campaign is already making a difference. To date, 18 new hires have joined Brockville General as a direct result of this campaign. In addition to our Imagine Brockville Life campaign, our hospital has been utilizing a number of additional recruitment strategies to bring even more qualified health professionals to the hospital. Since 2023, we've welcomed 458 new employees. 146 of those new employees were nurses. As a result of these efforts, vacancy rates have improved by more than 30% since 2023. The Imagine Brockville Life campaign and Brockville General's recruitment efforts are helping shape the future of healthcare in our community.
In the last year, the Brockville General Volunteer Association has given over 22,000 hours of their time to support patients, families and staff at the hospital. We have onboarded 32 new volunteers who have joined the association, each contributing to one of 23 different volunteer teams across the hospital and in the community. We've established a new volunteer team to engage patients in the transitional care unit. This team provides activities and general conversation with patients who are waiting to move to their new homes. The association has also donated $135,000 to the hospital to support purchasing new medical equipment. And this year, the association has been expanding its education and skill building program for volunteers, working with Brockville General clinical professionals so volunteers are comfortable and confident in the role that they play supporting patient care here at the hospital.
Being part of the facilities team often means working behind the scenes. From urgent repairs to scheduled maintenance and renovation, our impact can be felt in every corner of the organization. I'm very proud of the dedication and sense of pride that our team has shown in helping support patients and staff in a hospital that never sleeps. Over the past year, we have worked to improve the patient and staff experience across our site. A renovation in the solarium has given a fresh space for patients and their families to come together. This space has also been used to host several wellness events for staff to enjoy. Some other key items that facilities have been able to improve over the past year are a fresh outdoor space at the main entrance, new cushioned flooring in the cardio rehab, and continued renovations and upgrades to the aging areas of our legacy building. Construction of a new lab space has recently commenced under the direction of the facilities team, with an expected completion date of fall 2025.
One of our proudest moments this year was fully implementing our Comfort Kitchen food service model. Comfort Kitchen focuses on nutritional, familiar comfort foods and empowers our patients by allowing them to fully customize their meal choices. It features a 2-week rotational menu with 2 choices at each meal and an always available section. Patients browse the menu, choose their meal, and provide their choices to nutrition associates who visit them at their bedside prior to meal service. Our menu items are prepared and cooked on site, and since implementation, our patient satisfaction results have increased by 12%.
Our laboratory plays a critical, multifaceted role in a patient's hospital stay, influencing nearly every aspect of diagnosis, treatment, and monitoring. To help improve on patient outcomes, the Brockville General Hospital Laboratory collaborates closely with both the variety of departments in our organization and partner hospitals in the Southeast region. Development of the hospital's massive hemorrhage protocol was a main laboratory focus for the year. A massive hemorrhage protocol is a step-by-step emergency plan hospitals use when a patient is losing a dangerous amount of blood very quickly, like after a major accident, surgery complication, or childbirth emergency. The development of this protocol at Brockville General will reduce the guesswork and variation in treatment, leading to more consistent and safer care for our patients. In a partnership with Kingston Health Science Center, our laboratory has recommenced hosting medical laboratory students from St. Lawrence College. The students are able to complete 3 of the 5 disciplines of the clinical placement here in Brockville, while KHSC hosts them for the other 2. Through this initiative, we have welcomed 2 new laboratory technologists to our team. In a time when medical lab technologists are in high demand, this was a huge win for our hospital. A second regional collaboration was the implementation of the Celavision. The Celavision is a cutting-edge digital imaging and analysis system used in hematology laboratories to automate and enhance the process of cell morphology analysis, a key part of diagnosing blood-related conditions. Brockville General was the first laboratory to go live with this instrument in the region. I am extremely proud of my dedicated laboratory team as they were instrumental in the implementation of this new technology.
This past year, one of the projects we launched was our modernized staff scheduling system called UKG. Phase 1 was implemented between January and September 2024. Since the launch, we have now increased our accuracy, streamlined our processes, and have a strong understanding of its use of the software across the hospital in all areas.
UKG has provided a user-friendly interface for staff and managers to find information and complete their scheduling and payroll tasks. We have implemented a continuous quality improvement process where we use the software solution UKG in a way that optimizes the system to meet staff and managers' needs.
UKG's enhanced audit capabilities have helped us identify areas for process improvement. Managers now benefit from a centralized platform to manage all scheduling and payroll tasks efficiently.
We are now entering Phase 2 of the implementation of UKG. Phase 2 includes 3 aspects. 1, Vocantis, which provides an automated process for offering out shifts. Analytics, which allows us to have a better reporting framework. And last but not least, attendance support plan, which supports our leave processes, including long-term leaves.
Early in 2024, Brockville General committed to improving access to our acute stroke care for patients in Brockville and in our surrounding communities. This decision aligned with our mission statement to deliver the best healthcare experience to our community through collaboration with our patients, families, and our partners. Working groups were established with engagement from internal stakeholders of the emergency department, ICU, professional practice, stroke team, diagnostic imaging, and our labs. Our partnerships in these working groups also included a patient experience advisor, the Southeast Regional Stroke Network, Leeds Paramedic Services, and Ontario Health. After an incredible amount of dedication and persistence, Ontario Health announced on July 8, 2024 that Brockville General had met all of the criteria to be a recognized telestroke site.
Leeds Grenville Paramedic Service participated in a collaborative working group that would improve acute stroke care to patients in our city and region. Over several months of planning sessions, Brockville General became a telestroke site, and our paramedic crews no longer needed to take all patients with potential strokes to Kingston, Cornwall, or Ottawa. This allows patients to be treated here in Brockville, saves transport time, and gives us the opportunity to deploy our resources for other emergent calls.
I've been a patient and family advisor at Brockville General Hospital for nearly 5 years. In May of 2024, I was invited to join the Telestroke Working Group as a patient and family advisor. My wife suffered a massive stroke in 2017, which required both thrombolysis and endovascular therapy, interventions that ultimately saved her life. Because of this, I have a deep appreciation for the importance of these treatments. I was able to share my experience with the working group. From the beginning, I was made to feel welcome, and my input was always valued. As a member of the working group, I also took part in the telestroke staff training. During these sessions, I shared my family's stroke experience. In my experience, the staff interaction was critical, and throughout the telestroke implementation, I ensured that the patient and family voice was taken into consideration. In summary, it was a very rewarding experience to be part of this outstanding team that delivered a new life-saving capability to Brockville General. As a patient and family advisor, it is reassuring to know that Brockville General can now use video technology to connect with neurologists and support the timely delivery of thrombolysis closer to home.
Providing the best healthcare experience is our mission at Brockville General. We do this by ensuring our clinical teams have the resources they need for the delivery of safe, quality care through smart resource use. Every day, our support services are hard at work behind the scenes to make this a reality.
On the procurement front, we've expanded our participation of our new partnership with Mohawk MedBuy Corporation, one of the largest healthcare group purchasing organizations in Canada, to leverage their purchasing power and bring significant savings in pharmaceuticals. This partnership, in addition to bringing us savings, is also helping us navigate the challenges of the current economic environment and the evolving tariffs.
This year, we received $3 million in additional funding to address our surgical wait list. We also now have full funding for our new mental health and rehab beds, which opened in 2021. These significant investments have allowed us to balance our finances for an 8th year in a row.
This past year has been a true reflection of the powerful partnership between the Foundation and the hospital. Together with you, our donors, we've made a lasting impact on patient care in our community. We're proud to have launched our new Foundation brand, which aligns closely with Brockville General. It's a brand that speaks to trust, hope, joy, and growth, the very values that guide us in everything we do. There have been many highlights this year. Thanks to our donors, we successfully completed the Time for Beds campaign, raising $1.3 million to replace hospital beds, enhancing comfort and care for every patient. We were so proud to witness the unveiling of the new MRI suite, mammography suite, and EMAC rooms, made possible through the generosity of you, our donors. We also introduced the Wave of Gratitude program, a special way for patients and families to honor healthcare professionals and teams who go above and beyond. Every recognition comes with a donation that directly supports care. In addition, we launched Med Talks, a new series of community education events in collaboration with Brockville General and local health experts. These talks are designed to inform and empower you with knowledge to support your long-term health. And finally, we were so proud to bring back a beloved community tradition, the Palliative Care Telethon. With your support, we raised over $174,000 to fund vital outreach services for patients and families facing life-limiting illness. Thank you to each and every donor, volunteer, and partner who continues to make a difference. You are helping to shape a healthier future for our region, and we couldn't do it without you. Thank you.
Over the past year, we have made significant strides in key focus areas of our quality improvement plan, including access and flow, equity, patient experience, and patient safety.
Access and flow is a priority area for Ontario Health this year, and we have 3 indicators that interprofessional working groups are focused on assessing and improving, including wait time to see a physician in the emergency department, ambulance offload times in the emergency department, and waits for an inpatient bed for patients admitted through the emergency department. These processes are complex and integrated and require organizational support to both understand and improve.
As part of our equity initiative, an Accessibility, Inclusion, Diversity, and Equity Committee has been created. This committee will support the implementation of EDI processes and initiatives at the hospital. The committee is still searching for additional members, so please let us know if you're interested in joining.
We have a number of safety initiatives underway this year focused on understanding and assessing reported falls that result in harm, improving nonviolent crisis intervention training rates to better equip our staff to defuse escalating situations when needed, and improving hand hygiene compliance rates.
As part of our work to enhance patient experience, quality improvement planning teams are working to implement a pilot of the Essential Care Partner program on our palliative care and complex medical management unit. The goal of this project is to allow patients to identify their essential care partner, include the essential care partner as an active member of the care team, and support the essential care partner as needed through the patient journey. We will measure outcomes through our patient experience surveys to gauge patient satisfaction.
In summary, we have many initiatives underway this year, with a lot of exciting and necessary work underway. Our quality improvement plan is not simply a checklist. It's our living strategy driven by our mission to provide better care for our community every day.
After such a busy year, Brockville General is well positioned to continue to provide the care our community expects and deserves.
On behalf of all of our staff, physicians, learners, volunteers, and partners, thank you for watching. As we look to our future, rest assured that Brockville General will always be right here with you.